in today's video, we are going to talk about pneumonia. Pneumonia is an infection in the lung tissue caused by microbes, and the result is inflammation. The inflammation brings water into the lungs tissue, and that extra water makes it harder to breathe. During normal inhalation, air reaches the lungs by traveling down the trachea. Then it continues through the bronchi and the bronchioles and end up in the alveoli. The alveoli are tiny air sacs that are wrapped up in a net of capillaries. This is where majority of gas exchange happens in the lungs. Oxygen leaves the air into the alveoli and crosses into the bloodstream, while carbon dioxide leaves the bloodstream and is exhaled out of the body. Now, let's go back to pneumonia. In addition to air, we constantly breathe in other stuffs like microbes. But we are usually good at protecting ourselves. For example, we have mechanical techniques like coughing, a mucociliary escalator that lines the entire airways and moves out larger bacteria. We also have macrophages that are nestled deep inside the alveoli and ready to destroy anything that comes there. But sometimes a particular strong microbe will manage to escape these defenses and might succeed in colonizing the bronchioles and alveoli. And when that happens, then that is exactly how one gets pneumonia. These microbes typically multiply and cross over from the airways into the lung tissue, creating an inflammatory response. The tissue quickly fills with white blood cells as well as protein, fluid, and even red blood cells if the nearby capillaries get damaged in the process. Now, there are lots of different pneumonia-causing microbes, but usually it is caused by viruses and bacteria, but it can also be caused by fungi and a special class of bacteria called mycobacteria. In adults, the most common viral cause of pneumonia is influenza, sometimes called flu. In adults, bacterial causes include Streptococcus pneumonia, Haemophilus influenzae, and Staphylococcus aureus. There are also more unusual bacteria like Mycoplasma pneumonia, Chlamydophila pneumonia, and Legionella pneumophila, which can cause an atypical or walking pneumonia because they often cause vague symptoms like fatigue. In individuals with normal immune system, fungi are a rare cause of pneumonia and often it is regional. One special fungi culprit is Pneumocystis jirovecii, which is a risk for immunocompromised individuals. Finally, there is Mycobacteria, which are slow-growing fungi, hence the myco in their name, even though they are still bacteria. The most well-known one is Mycobacterium tuberculosis, also known as TB. Pneumonia can also be categorized by how it is acquired. The most common is community-acquired pneumonia, and it is caused when a person gets sick outside of a hospital or healthcare setting. Next is the hospital-acquired pneumonia or nosocomial pneumonia, which is when a person gets pneumonia when they are already hospitalized for something else. This type tends to be more serious because sick patients often have a weakened immune system, and microbes in the hospital are more resistant to common antibiotics. A well-known example is methicillin-resistant Staphylococcus aureus, the MRSA. Non-resistant normal staph aureus can cause pneumonia and other infections, but are also easily killed by common antibodies like ampicillin. But MRSA, on the other hand, is resistant to many antibodies and is therefore harder to treat. Another category of pneumonia is ventilator-associated pneumonia, which is a subset of hospital-acquired pneumonia, but it specifically develops when individuals are connected to a ventilator. Now, in addition to inhaling microbes, there are other ways to develop pneumonia. Think about this: you are eating some French fries, and instead of swallowing one, you accidentally breathe it in. So we can say you aspirated that French fry. Normally, you automatically gag and start coughing. And with this, you can walk the French fry out of your lungs. But this gag reflex can sometimes be compromised. So in these cases, the French fry might get stuck around the lower airways in your lungs. Now, of course, the French fries aren't sterile, which means they have microbes on them, and these microbes can infect the lung and cause pneumonia. And this type of pneumonia is called aspiration pneumonia. Aspiration pneumonia can also happen with drinks or even gastric content, like after vomiting. Aspirated gastric content can be particularly very dangerous because the stomach acid can cause a chemical irritation in addition to the possible infection. Now, another way we can categorize pneumonia is by where the infection is. In bronchopneumonia, the infection can be throughout the lung, involving the bronchioles as well as the alveoli. In atypical or interstitial pneumonia, the infection is mainly just outside the alveoli in the interstitium. And in a lobar pneumonia, the infection causes complete consolidation of the whole lobe of the lung, meaning the entire region is filled with fluid. The vast majority of this is caused by Streptococcus pneumoniae. Now, pneumonia most often causes shortness of breath, chest pain, and productive cough, meaning the pus or bloody septum might come up. Often, there are also systemic symptoms like fatigue and fever, as we have said before. Diagnosis of pneumonia is usually made in a person who is working hard to breathe or breathing quickly. A chest X-ray of bronchopneumonia typically shows patchy areas that are spread out throughout the lungs. In lobar pneumonia, fluid is localized in a single lobe or set of lobes. Another way to detect lobar pneumonia is to look for dullness to percussion, which suggests that there is a lung consolidation. Since bacterials are the most likely cause of pneumonia, antibiotics are often prescribed. In addition, cough suppressants and pain medication are often used to help these symptoms. So let's have a quick recap. Pneumonia is an infection of the lung that results in the air sac being filled with fluid. The disease can be classified by being either community acquired, hospital acquired, with some of those being ventilator associated pneumonias or aspiration pneumonias. Pneumonias can also be categorized by where the infection is in the lung. For example, bronchopneumonia is spread throughout the lung. Atypical or interstitial pneumonia happens in the interstitium around the alveoli, and lobar pneumonia usually infects the entire lobe of the lung. So there you have it on pneumonia. Thanks for watching. Please don't forget to hit the subscribe button and share this video to those who might also learn from it. Until next time, thanks for watching.